Our presentation is going to cover two areas. The first is the clinical strategy for the Imperial College Healthcare, and then the second part of the presentation, which Orchard will deliver, is around the changes at Hammersmith A&E department. So if we can move to the first slide. Firstly, just a little bit about Imperial College Healthcare NHS Trust. As I'm sure the Council is aware, we are one of the largest NHS trusts in England. We have about 10,000 staff and see about 1 million patients each year, and we deliver services from our five main hospitals: Charing Cross, Hammersmith, Queen Charlotte and Chelsea, which is co-located with the Hammersmith Hospital, St Mary's, and our specialist Western Eye Hospital. Very important part of the services we deliver is our research and education, and we're in very strong partnership with Imperial College, and together we formed the first academic health sciences centre in the country back in 2009. Over the last few months, we've been working hard on the development of our clinical strategy, and thinking about our clinical strategy, we're going to back out to our staff to talk about the vision for our organisation, and importantly what we see as the strategic objectives. With one particular objective I would just like to focus on there, which is that last objective, and it really does resonate in terms of shaping a healthier future. Obviously, from our perspective, it's incredibly important that we continue to deliver an excellent patient experience and excellent clinical outcomes. And those clinical outcomes do need to be underpinned by research and translation of research into better clinical practice, and also a key focus on education of our staff and ensuring we're training the workforce for the future. But that last objective is about really looking at our models of care and ensuring that we have a seamless interface between our hospital services and those services provided within the community. So we really do want to look to those new models of care and to ensure that we're really looking at our services in terms of the health of the community we serve, not just the health of the patients that come within our four walls. In looking at developing our clinical strategy, we have looked at the drivers for change, and these drivers of change are pretty consistent around the world in terms of thinking about clinical services and the way that they are here. We know that we have a growing population, and in addition to a growing population, our population is changing, the population is ageing, and with that ageing comes multiple and chronic conditions. We're well aware that there is a rise in technologies and in how you can use those technologies to target care to particular patients. In looking at the community's expectations, the community expectations have changed over the decades, and patients now expect to be more in control of the care that they receive, and for that care to really be focused around their particular needs. And obviously we couldn't talk about the drivers for change without talking about the not unlimited public purse in terms of delivering of public healthcare services. So we need to be fiscally responsible as we think about our clinical strategy. The drivers for shaping a healthier future are well understood. Localising services wherever it is possible to put them close to where the community lives, centralising services where it's necessary, particularly around specialist services, integrating care across all the various continuums of care, and personalising the care and the services to the needs of the individual patient. So looking at our clinical strategy, this is the framework for our clinical strategy, and I've gone into this in a lot of detail, but just to highlight a few particular areas. In any clinical strategy, it's important to look at the defining services, and those defining services for Imperial College Healthcare are very much linked to our Academic Health Sciences Centre and those clinical services for which we're well renowned and for which we have excellent education and research underpinning those clinical services. We want to do a body of work over the coming year with Imperial College to really work on those defining services and how we will continue to invest in those going forward. The clinical strategy also talks about the 3 new models of care that we will particularly be focusing on during the coming year. The first becoming 5 years of the strategy. The first is around systematised planned care. So looking at wherever you can, and it gets back to a point that was raised earlier when Steve McMillan was at the podium, really talking about the administrative services that underpin the delivery of many clinical services and how you can look at systematising some of your services, whether that might be your outpatient services, your elective surgical services, to really improve the efficiency and the effectiveness with which you deliver care. The second is around integrated care and making sure that the care is seamless between different hospitals within the trust, but also with different care providers, be they community providers or social care providers. And the third area is around personalised medicine. There's been obviously a great advance in terms of genomics technology and genomics therapy, and how you can really target services now to the individual and personal needs of each patient, particularly in cancer services. A lot of the work that we've been doing is looking at optimal clinical service adjacencies within each of our facilities, and underpinning all of that by good process redesign. So our clinical strategy is structured around a 3-site model. This was the model that was consulted upon within Shaping a Healthier Future, which defines Charing Cross as a pioneering local hospital, Hammersmith Hospital as a world-leading specialist centre, continuing to be co-located with Queen Charlotte and Chelsea Hospital, and St Mary's Hospital continuing to develop as a major acute centre for North West London, co-located with the Western Eye Hospital. Move to the next slide, please. I've just gone into more detail on this slide on the Charing Cross Hospital and some of the services you might expect to see at the new local hospital at Charing Cross. So in terms of the services that the Trust would be delivering, obviously a comprehensive diagnostic suite of services with imaging and pathology supported by pharmacy, transitional care and rehabilitation services, day case specialist medicine and surgical services, so day surgery services, and specialist medical services such as endoscopy, renal dialysis and day chemotherapy, and urgent and emergency centre appropriate for a local hospital. Unfortunately, outpatients has just dropped off that list. Outpatients should obviously be identified, and that specialist outpatient services within the Trust services. Our services will be integrated with other partner services, and those services will be focused on primary care, cancer support services such as those provided by the Mackey Centre, education and wellbeing services, and Imperial College will be co-located with us to continue to deliver education and research on that side. Mental health services will be located there. In terms of the size and scope of the facility, the number of beds we're anticipating in terms of inpatient beds is 24, day case beds 86, and 6 operating theatres. There will also be local treatment rooms there. And in terms of the site requirements, the local hospital we anticipate will take up an area of about 1.25 hectares and have a floor space of about 25,000 square metres. We can move on to the next slide, please. In terms of the implementation of the clinical strategy obviously needs to be underpinned by a number of enabling and support strategies. These are in the process of being developed at the moment. We have an education and research strategy which are in the process of being updated. We do have a transport strategy, but we certainly need to continue to do more work on that, work on our people strategy to really support the models of care that I've discussed, continuing to engage with the local community, and underpinning ICT strategy and an estate strategy to support the implementation of the clinical strategy. Our draft clinical strategy will be going to the public session of our Trust Board next week for consideration by the Trust Board. Part of the implementation of that strategy involves the creation of a clinical transformation office to really drive the changes in the clinical practice that will be needed to implement the clinical strategy, and at the same time going to the Trust Board will be an outline business case for the capital redevelopment developments associated with the implementation of the clinical strategy. From there, that outline business case will be going on to the commissioning group and the Trust Development Authority. So I might just hand over to Tim Orchard now just to talk in more detail about changes around the Hammersmith